Welcome to Masterclass here to Mind for All Seasons, everybody. I'm excited about today's topic because it's pertinent to both family and professional caregivers, and we have a lot of them in our AmFast community. And many of you have already met and interacted with and been taught by Dan and John from Seven Movements Health. I'm so grateful that they're involved in our community, that they're holding office hours on a regular basis. I hear from people regularly that it's been very helpful for them. And today we want to really target our approach toward people who are caring for someone in the home or in a professional setting, because there's a sort of athleticism that's involved in caring for other human beings that need assistance with transfers and standing up and down. And there's some real physicality to the kind of work that frontline caregiving staff do. And in an age when it's really difficult to find good people, we got to keep them as healthy as possible. And Dan and John have worked hard for years to develop an understanding of how athletic caregiving really is. And they used a term the other day when I was talking to them that I thought was really significant. They called it clinical athleticism.
Mm.
Now, we think of athleticism in terms of the Olympic Games that are underway right now. That's definitely athletic and it's very physical. But when you are caring for other people in a clinical setting or even in the home, there is a high degree of athleticism, which means we need to train, we need to warm up, we need to do the right things for our bodies. So, without any further ado, I'm going to hand it off to John and Dan and their capable hands to walk us through exactly what we and people that we're working with can do to protect our bodies and keep serving for the long haul.
Amazing. Thanks, Eric. And hi, everyone. And great to see some familiar faces on the call from office hours. John and I are, as always, very excited to present to the AmFast community. And this is a really fun. I think we're gonna have a fun presentation and a fun chat with you guys today. So the goal today is to kind of do a little bit of presentation. We're gonna do a little bit of movement with John, and then we're gonna leave some time for Q&A at the end. As we found with this community, that's kind of where the magic really comes out, is when you guys get curious about stuff. So maybe I'll kick things off rather than reintroducing seven movements, since most of you have kind of seen that already. Um, we've been around for a long time, since 2014 when we sort of introduced this concept of microdosing movement to the exercise community. Since then, I've been involved with University of British Columbia and McMaster University, clinically validating some of our microdosing movement protocol with different disease states. And more recently, I'd say probably within the last 3 or 4 years, hey John, like we've started looking at this movement snacking approach to different occupations. And that's where things got really interesting, and kind of what the presentation today is all about is, hey, how do we take this movement snacking approach, getting people moving 1 to 7 minutes at a time throughout the day, and make it effective for different populations. So what I'm going to do is a little bit of a preamble presentation just to set the stage. But I hope everybody's ready to move a little bit today with John, because he wants to give you a few examples of what this could tactically look like. Um, and what's really important, I think, as we sort of just open the presentation and the conversation today, is when we look at caregivers, as we sort of define them, this can be anyone who's caring for someone else. So you might be in home taking care of a spouse. You might be the adult child taking care of a parent. You might be working in a residence, taking care of multiple people. And what's really interesting is when John and I break down the what we call like the task demand of the clinical athlete operating in these environments, things get really, really interesting as we look at it through an exercise programming lens. And that's what we're going to help you kind of hopefully look at today, as well as the goal, especially the beginning part of this presentation, is just to shift your mindset of how we look at taking care of your body as a caregiver um, in today's environment. So I'm going to share a little presentation, which I don't always do, but I think it'll help keep me on track and John on track, because we're used to doing office hours with you guys and bouncing all over the place, which is really fun too. Um, but let's just go. Let me see if I can bring up a specific tab here. John, did I miss anything while I do this?
No, one thing maybe we could add is that like our background was in developing athletes. So me personally, I was an athletic trainer and strength and conditioning coach for professional and Olympic athletes. So we kind of approach this in the similar manner that we would be if we're training hockey players or if we're training basketball players or um, uh, any sport for that matter. And so we take the same thought process of working with athletes just in a completely different occupation. Like my mother was a registered nurse of 50 years. My mother-in-law was a nurse's aide. My grandfather was a medical doctor in the British Navy. And I started thinking differently about this just in hearing all the stresses that my mom was going through specifically, and then seeing all her coworkers struggle with working in the residencies in a rural hospital. So that's kind of like made us shift the way that we look at how do we prepare people for their occupations, like Dan was saying, in order to be successful for their shift. And I like to say that, you know, it's incumbent upon us as caregivers to be able to be the best that we can be when we've been given the power to care for people when they're at their worst.
Amazing. Thanks, John. Can you see my screen, John? All
Yep.
right. Okay, perfect. So I want to kick things off today by just introducing this concept of the clinical athlete. So turning movement into your greatest tool of care. And John sort of primed this for us is when we start to look at different occupations through an athletic lens, there are a lot of interesting analogies and comparables, which got really fun for us. But I think what we really want to do is kind of talk about how do we do this identity shift? Because when we end up talking to nurses and caregivers in particular, quite often they're the folks who put other people before themselves. It's their natural state, right? That's the mindset they go in with. So when we start talking to them about occupational wellness or workplace wellness or just taking care of themselves in order to take care of others, we usually kind of get like a nod. Yeah, I think that's important. Um, but they don't think of them taking care of their bodies as a form of performance or a performance operational readiness. Hey, if I actually take care of myself, I can actually perform better for the people in my care, and I can perform longer. Um, and what we really like to go in and talk to our caregivers about is let's move away from this idea that I need to sacrifice my body to care for others. We know where that leads. We know where all the statistics lead around burnout, injury, even resentment can build in with that approach. Uh, Shifting it to an athletic mindset. So maybe just by raise of hands of people I can see on the call, how many of you have been an athlete or considered yourself an athlete at some point in your life, whether it was high school before? Maybe just give me a raise of the hand. Okay, we got a few athletes on the call. And when you're an athlete, the mindset isn't I need to sacrifice my body to do anything. It's I must maintain my equipment so I can perform at an elite level for my patients. So that's the mindset set shift that we're trying to help them transition through. So when we talk to caregivers about this, self-care isn't selfish. It's operational readiness. This is part of your job. This is important for you to be able to take care of people. So we like to get pretty bold with that. And when we're talking to caregivers, talk about how them taking care of themselves is probably the most important part of their job because when they go down, the people in their care aren't getting the care that they want them to have. So as we talk about this today, think about that the people in your life who are caregivers or you're a caregiver yourself, think about that identity that you're embracing and think about if I transition to this more athletic mindset, the mindset of an athlete, and I started thinking about myself in terms of performance and in terms of preparation, in terms of recovery, what would that look like for my day as a caregiver? I always drop this slide on everybody. Yes, we are serious. Preparation and recovery aren't extra work. This is the pushback we get from administrators, whether they be in hospitals or HR people of a trucking company, is okay, this is nice extra stuff they should be doing outside of their job, right? And it's for us, the answer is like, no, preparation, recovery aren't extra work. They're actually a fundamental part of the job. They might be the most fundamental part of the job. If you think about the tasks that a caregiver is required to do throughout their day, you cannot pour from an empty cup. You must maintain the vessel. So let's talk a little bit about movement snacking. And John, this is where I'm going to bring you in. And this is where we're going to talk a little bit about movement snacking from a caregiver perspective. And I want you to think about a caregiver's day, whether that be someone at home who's providing 24/7 care, or maybe someone working in a residence that's working a 8 to 12-hour shift. Think about the amount of movements and task demand that is placed upon those folks. And let's think about how we could use movement snacking as a way to prepare or recover the body in the moment, or act as what we call a neurological reset. Like how could we use a 1 minute dose of movement to help a person overcome a chronic stress state that they've been put in because maybe something they've just had to do or just had to deal with. So, Johnny, I'd really love for you to kind of take the group through a couple of things here. Let's talk about what a pre-shift movement snack would look like. And we're using kind of occupational terminology here. So pre-shift, if you're taking care of someone at home, your shift probably starts right before they wake up, and your caregiving duties sort of start. So let's talk about a pre-shift activation to prepare the body for the day. We're going to talk a little bit about those like 1 minute snacks you can do throughout the day to make your day a little bit better. And then we're going to talk a little bit about a post-shift reset. So what do you do at the end of the day to just kind of like, let's get started again. And then John will dive into like all of the benefits of that. So I'm going to stop sharing screen, John. I'm going to pass over to you to go into the movement snacking portion of our presentation here today.
Sure. If there's one thing that I could add, guys, if you have a piece of paper, just write down, there's 4 domains of performance. Okay. And so this exists in all walks of life, but the strategies that we're going to use today, while they seem movement related, they fit into the first domain of performance, and that's called physical. So you'd write, if there's 4 domains, number 1 is physical. Number 2 is mental and emotional. So mental/emotional. Number 3 is cognitive. And number 4 is social. And so everything that we do, there are strategies that we employ that are going to affect more than one of these performance domains, sometimes all of them. There's some strategies that we use that are ubiquitous through all of them. But I want you to keep that in mind as we go through these strategies and think about how, while what we're doing is movement, what is it doing to those other domains of performance? Is that fair? Yeah, cool. All right, so the first thing I'm going to do is I'm going to take you through a 7-minute, maybe move you over here so you can see my feet easier if I do it like this. There we go. I'm going to take you through a 7-minute prep, or how we would prepare you for your particular shift. So I would love for you guys to get up and do this with me, because in order for it to feel effective, that's the most important thing. So if you get up, I'm just going to have you stand here, and I like to do like a test retest kind of thing. So first thing we're going to do in this 7-minute dose is I just want you to kind of sit down like you're squatting into a chair. Just get a sense of what that feels like in your lower back and in your knees. Okay, what does that feel like in the ankle joints? And this is just kind of like a check-in with how your body is functioning in this one particular plane of motion. Okay, and now what we're going to do is we're going to start some strategies. So I'm going to start my clock here, make sure that I stay on time. And the first thing we're going to do is what we call a rub and scrub of the pelvis. So you're going to take your knuckles We're going to drive some circulation into your lower back. You're going to take your knuckles and we're going to rake it up and down. Put a lot of pressure in there so you can start to feel like some heat going in there. And what we're doing is we're changing the fluid dynamics directly to this tissue. So I'm driving up and down. I'm going to go side to side across my lumbar spine. I'm going to go on these little bones on the outside of my hip. Getting on these anchor points. There's these bones on the front of the pelvis. I need you to rub those ones. Okay. And then go ahead and sit again and see what that feels like in your lower back and in your hips. If that kind of made it feel like you're moving a little bit better, then that's awesome. Okay, and then the next one we're going to go to is we're going to rub and scrub the knee. So I'll just bring my foot up here so you can see what I'm doing here. And I'm just going to drive. It's like Mr. Miyagi. You remember the Karate Kid thing where he's like rubbing his hands real fast? We're going to rub it up and down over the knee. You can go right up and down the shin bone. Right on the outside of the knee. Okay, and this is the real fun test. We're going to retest your squat, but only after scrubbing one knee. So go ahead and squat, and you'll probably feel like you have more motion on one side than the other, on the one you just scrubbed. Pretty cool, eh? So let's go ahead and do the other side, because if you don't, you'll be walking in circles all day. Be like Zoolander, you can't turn left. Okay, go ahead and reset, try a squat. You should feel like you're getting a little bit deeper and have more range of motion at the knee joint itself. Okay, so if we're establishing better motion, then that's going to prepare my body to be able to take more forces because I can spread that stress into a joint that feels less sticky and gives me more space in that joint. Okay, so now we're going to go mobilize the hips. So hands are going to be on your hips. Let's put one foot further forward than the other. So we're staggering your stance. And you're just going to slowly take your hips left to right. Okay, now we put the other foot forward. Same thing, hips are going left to right. Okay, then I can switch feet again. This time I'm going to turn my hips, turn my torso. Okay, put the other foot forward, turning the torso. Okay, then we go other foot forward again. Drive your trunk forward. So your hips, trunk goes forward, bum goes back. Then hips go forward, trunk goes back. Okay, other foot forward, same motion. Trying to liberate the areas around the lower back and the hips. Okay, go ahead and try your sit and reach now. So we're just going to sit, and as you sit, reach forward. You should probably feel that you're getting a little bit more motion here. Get a little more space in the low back. Go ahead and reach at the shoulders, but reach your bum back as far as you can. Good, let's go ahead and let's reach across your body in both directions. So we're doing some omnidirectional reaching. Put the other foot forward. Keep reaching in opposite direction. Okay, we're going to reach overhead, drive your hips away from you while you're still sitting back. Okay, next one we're going to do is we're going to take a step forward. As you step forward, go ahead and reach with your opposite hand. So if I step forward with my left leg, I'm reaching with my right hand across my midline. We're going to do the other side. You're going to alternate left one to right one. Reach across your midline. So if cross my center. Cross my center. Okay, let's step to the side now. Twist your hands across your body. Alternating left to right. This is lengthening the big muscles, the big house in the back of the hip, the glute. One more time. Good, and then we're going to bend towards your toes. Reach up towards the sky. Bend towards your toes. Feel like your spine is rolling into flexion from top to bottom, then unrolling from bottom to top. So now we're asking the spine to help us a little bit in this motion. Very good. And then the last one we're going to do is I just need you to clap your body. And there you have a 7 movement prep ready to rock and roll. That should have set you up to feel like I've got better motion, I'm more awake, I'm ready to go, and I'm ready to take on my task of the day.
Awesome, John. Thank you.
Welcome.
Thank you. Yeah, sorry, I realized my images weren't popping up on the presentation earlier. So I thought I'd just go back to it before we go to the 1-minute snacks, John. So it's you all just walk through a 7-minute preparation that someone could do before their shift, right? So they go into that shift with their body prepared for the task demand that is going to be placed upon them that day. This is like kind of the comparison I like to give to my caregivers sometimes. If you think about our pro athletes, our pro football players, they perform some important tasks during their game, arguably less important what our caregivers do. They have to catch a ball or throw a ball, run down the field, get hit. They perform for 2 or 3 hours once a week, right? And they're surrounded by a team of trainers. Warm-ups and recovery are happening. They got high-end gear. So they're prepared. They're prepared for that athletic demand that's going to be placed upon their body. Now, I want you to think of an average caregiver working a 12-hour shift in particular. Just presented to a group of nurses talking about this. I want you to think about what they do throughout the day, the bending, the lifting, the shifting, and then start thinking about the cognitive load that gets placed upon them and that demand that then gets placed upon their body. Running about throughout the day, putting in steps, lifting, turning, being hunched over, filling out paperwork, doing all the things that a caregiver has to do, whether it be in a residence or in the home. And to top it all off, there's no off season for them, right? They're going 365. So we prepare athletes for a 60-minute game. We prepare them for a week for that 60-minute game, but yet we expect caregivers to play a 12-hour game with no prep or recovery. It's the wrong approach. They're going to get injured and burned out. It's actually a consequence of them not preparing or recovering. It's actually built in to it's what's expected to happen to someone. We would absolutely expect any athlete who doesn't put any sort of preparation or recovery into their athletic endeavors to then go out and perform on the field. We would expect them to get hurt. We would know they were coming back to get hurt, and they'd be calling John, and they'd be like, John, I pulled my hamstring, I hurt my shin, I blew out my knee, whatever it might be. My shoulder hurts now. It would be an expectation. Yet we're expecting our caregivers to handle that task demand without the proper tools in place. So there needs to be a shift. So how do we apply a pro athlete rigor to caregiver preparation? John just showed you, right? A movement snack of 7 minutes can make a big difference in them going into their day. Now I want to talk, John, a little bit about bringing 1 minute snacks throughout the day, those quick, whether they be neurological resets or just physical resets, when would you recommend them build that into their day? And what does one look like? Give us a couple of examples of, I'm thinking the one that you always showed me is like the rub and scrub that I can do around my neck and head when I'm starting to feel a headache coming on,
Yeah.
or anything else that you can kind of think of. So I'm going to drop the presentation, go back to you here, John.
Yeah, so if you're an administrator or somebody's in front of a screen for long periods of time, or maybe you're like doing prescriptions and you're having to fill pills for people, one of the challenges is that you always have a fixed gaze with your eyes, right? You're always fixed forward. Well, as we know, being stagnant and not moving is not good, not only for the whole body, but even for the nervous system and the optic nerve as well. So if your eyes don't move in different directions like athletes need to, we need to create better movement at the eye. So what we're going to do is I'm going to have you close your eyes and just look beyond your screen and then just open them. And I want you just to take a little inventory, if you will, of what that image looks beyond your screen. Like, how sharp is it? What's the contrast? What's the color like? And then what we're going to do is I'm going to do a strategy for your eyes and for your neck. So the first thing we do is we want to drive circulation to that area. So I'm going to start my clock at 60 seconds and show you how to do this. You just follow along with me so we can keep it short and sweet, but it's going to be highly effective. So the first one we're going to do is you're going to take your hands and we're going to massage the back of the head. So we create that same Mr. Miyagi effect by scrubbing the bone right where it meets the neck. This is where the optic nerve originates at. Okay, so what we're doing is we're driving circulation to the area and the region of the connective tissue that supports, but also is the origination point of the optic nerve. So I rub and scrub there. And then what I want you to do from here is we're going to test your neck motion going up and down, side to side, and then tilt it ear to ear. So go ahead and close your eyes after you've done that. We've stimulated the vestibular system. We did a rub and scrub. You go ahead and open up your eyes. You should feel like it's starting, everything starts to register and be a little bit more clear. And I've got a better picture or contrast to it. So for me, everything seemed brighter and everything seemed sharper just from that simple little strategy. Now what we're going to do is we're going to drive some motion of the cervical spine. So I'm going to have you step. You're still up. We're going to have you move. What we're going to do is you're going to step forward. And as you step forward, I need you to turn your head in the same direction that if your left foot's going forward, you're going to turn your head with your left foot. Turn it with your right foot. So I look to the left. If I'm stepping left, I look to the right if I'm going right. We're just doing an alternating step and neck motion together. The benefit to this is I get good motion in the neck, but my eyes are moving away from a fixed position. Okay, and then we're going to go same thing with the step, but here I want you to look up as you go forward. Look up. So my chin's going to come up as I look towards the sky. Okay. And then on this next one, you're going to step forward. I just want you to tilt your ear down like you're pouring water out of your ear. And we're going to stop there. So there's a very simple thing that you can do that involves the eyes, the neck for both motions, but also stimulating the vestibular system, which is our writing reflexes, which often never get trained because we're always dealing with our head in a very stagnant position. So it's one way that we would counter strain from our eyes always be fixed in one position. I'll tell you one quick story if I can, Dan.
Go for it.
I had this opportunity to train one of the most well-renowned transplant surgeons down here in Florida. And he was the first one that came to me and said, hey, you know what? Like, my surgeries are sometimes 15 to 17 hours in a row where I'm doing like transplants on babies. So I've got like these crazy telescopic glasses on, and I'm in this position for like 15 hours. Could you imagine what that guy's neck looked like? He had like a hump like a camel. because biology in its infinite wisdom is going to lay down collagen to support that structure so that he can be here and do his job so meticulously. But he said the problem is when I try to move, I'm kind of like this now, and it affects the other parts of my life. So we had to employ different strategies to decompress him and be able to give him things to do while he's in surgery, so he's not in so much pain, because little kids' lives were in danger, right? And these transplants were so important, he couldn't make mistakes. So that's where I started thinking differently about this concept of counter strain. What is the strain that I'm doing? And then what is the counter strain to it that I might have to employ as a result of my demands for work? And so that's the approach that we're taking there. In the instance that Dan was talking about of what might we do for headaches, oftentimes it's because our eyes aren't moving and this whole structure isn't moving at all. And the aura that you get from a migraine usually kind of comes to the frontal lobe and affects your vision, right? You sometimes get those like spotty bits. And so us attacking the optic nerve and creating cervical motion can help alleviate some of those symptoms. So that's why I wanted to explain to you why we do these strategies.
Amazing. Yeah, I mean, the headache one, John, changed my life because I was a guy who I spent a lot of time at the desk and computer, and I would get headaches that would turn into migraines. And now I do that simple movement snack. Actually, I do it every 30 minutes throughout the day. So I'm probably doing it 16 times a day, but I don't get headaches at all anymore.
Brilliant.
So, just to give you an idea of what that snack routine could look like for a caregiver, right? Your 7-minute prep. Here's how you start your day. You sprinkle these movement snacks throughout the day, and then you have a post-day routine. And obviously there's an educational and iteration component to this. Like everybody finds their favorite 1-minute movement snacks that are kind of helping them. And that just takes time and practice and kind of testing to see what your favorite snacks are. So the question we always get, obviously, is like, okay, how do you operationalize this? This is fantastic. Like we should be doing this. So how do we build like a culture of movement? And from John and I's experience, at least working particularly in the healthcare space, is like you have to model the way. You have to start doing it. When you can get the caregivers and the leaders in an organization valuing movement, then everybody starts to adopt that athlete mindset, and they're like, okay, I need to be operationally ready for my job. So how do we build culture? I think Simon Sinek said this, culture is built when values meet action, right? So if our value is, hey, we want to prepare and make sure that we can perform our best throughout the day, let's actually start doing it. The snacks are easy. You just saw movement as medicine in action. And the problem that we have sometimes is when we think of movement, we think of exercise and we think of fitness, which is fantastic. Those are great things and very healthy things and things we should be participating in. But what we can do, particularly as we operationalize movement snacking into an occupation like this, is say, listen, the movement that we're going to be doing is all tied to making you feel better and perform better in your job. We're going to prepare and recover your body like it's an athlete so you can have that elite performance throughout the day. So if you are in a caregiving role right now, if you know someone who is, ask them the question. If you treated your body like an elite athlete for just one shift, what's the first thing that you would change? How would your day look different? And we don't need to answer that right now, but it's a good question to ask yourself and a good question to ask your staff. It's a good question to ask your leadership. How would this look different if we were to like start treating our caregivers like athletes, start preparing them, start helping them recover? What would it look like if our caregivers didn't burn out or they were able to perform at hour 8 or 9 of their shift just like they were at hour 2 or 3? How would that impact the care that the people in your residence are experiencing, as well as just the life of the caregiver themselves? So I'm going to quickly go about how we think about this. at 7 movements. And then I want to open up for Q&A. So drop that into the chat. And John obviously has a recovery strategy to wind down the session as well. But I'd like to get a little bit of Q&A. So the question we often get is like, okay, how do you operationalize this thing? We can convince everybody that movement's good. We should be doing this stuff. How do we do it? And we always pull out this EEE framework, is what we call it: educate, environment, and enablement. So for us, our education is, we want to get John in front of the leadership. We want him to teach them about movements, just like we're doing today. Because once everybody buys in and feels and experiences this, they go, oh yeah, like I see the value. And they start to understand how they can use movement snacking with people in their care, which gets us really excited. The other piece that gets missed on this all the time is the environment. We need physical anchors in the environment to remind people to move. We've discovered, even though we have technology and we love technology at 7 Movements, that putting an app in someone's hands isn't enough to drive behavior. It'll help. It'll give them a tool to access education and content to participate in a new behavior. But if they don't have the physical anchor, the physical reminder, so how do we do that? We do things like putting recovery spaces into break rooms. John's building a facility right now for caregivers up in Ontario, Canada, that's focused on giving them the programming and the environment to then go and do the recovery and prep and all that stuff that we talked about today. And then, of course, the enablement, that's the technology and content. That's the 7 Movement stuff that we do. That's how we kind of get that conversation started in bringing movement snacking to the caregiver community. And like say, whether that's folks who are caregivers at home or working it as an occupation, it really doesn't matter. The principles remain the same. Treat yourself like an athlete, take care of your body, and start movement snacking throughout your day, so you can perform at your best, be operationally ready to perform, and provide elite, what we would call elite service, or elite caregiving to the people in your care, which is what everybody wants to do. John, anything to add to anything I said there? And I'm going to jump into the chat, see if we can get some questions rolling.
No, let's jump into the chat.
All right. So John, Carol asks, the routine, was this routine the basis of the videos to mobilize the pelvis that you mentioned to me a couple of weeks ago? Do you remember that?
No, I've been hit in the head a lot being a former hockey player, but
it's okay.
It is one of them, right? So we have I have lots of different routines that we could do for it, but it is certainly one that would have mobilized the pelvis. That was the intent today, right? Is to, for a caregiver, oftentimes my sister works in occupational health and safety for Alberta Health Services. And some of the reports that she explains to me is that lots of people have low back pain, hip pain. They end up getting it from trying to move people. And so what we do is, one of the preps that I chose today was specifically for the hips and lower back, right? And so that's why I had you moving your hips in lots of different directions, and then sitting and reaching in different directions to get the thoracic spine involved as well, because the thoracic spine is the guardian to the lumbar spine. So the sacrum and the pelvis is the guardian to the lumbar spine as well. So if I can get all those to move really well, then my lumbar spine is going to be less vulnerable. But yes.
Excellent. Yeah, I'm definitely going to do this.
Good.
Thanks, John. Holly dropped a comment in here. Rather than look for the first opportunity to sit down, retrain yourself to first reset your body with movement, which will increase energy and longevity. This is absolutely perfect from an athletic point of view. When we finish an athletic event or a workout, taking time for restorative movement and breath work is even more important than the workout itself. Same for our caregivers. Movement will be a key to longevity. I love that, Holly. I mean, that's kind of what we're talking about, right? It's if we think about how we perform in athletics and we apply that to a caregiver, that's exactly it. How do we give them the tools to do that? So I love it. Eric, I'm going to get to yours, and then Rhett, I see you have your hand up too. So Eric asked John, you've helped many in assisted living, skilled nursing, and other professionals learn to adopt more of an athlete mindset. What's the first roadblock people run into when working to operationalize this idea, and how do we overcome it?
HR. No, I'm kidding. Oftentimes it is. But in reality is we need to get to the soldiers on the field, so to speak, right? Like the only way you truly improve operations is not from the executive down, it's from the soldiers up. So what we found is that when everybody, and the reason why I told you guys about those 4 domains of performance is that those are specific to everybody's jobs in that um, in that occupation. So it's not only just the caregivers, but also the administrators. They have different demands, right? So everybody has a job requirement that makes them a certain type of athlete, just like we have different positions in sports that have different demands. Their tasks might, or the game might be the same, but their tasks are different that create the entire successful outcome of an organization or a team. And so what we have to do is we have to look at what strategies can we implement that would make everybody feel like they're performing better at their job. For us, because we're a movement company, we start with movement because it's ubiquitous through all 4 domains of performance. If I get you moving better, you're going to feel better physically. We're going to change your mood state immediately. So it's going to improve your mental and emotional state. We can do specific strategies to even change your mood. So if you have low energy or you just kind of feel like, I just don't really feel like doing anything right now, we can change that just through specific, like body clapping is one way. So I'm doing something percussive on the body or using a percussion gun. That's going to change your mood state. Doing percussive breathing is going to drive the sympathetic nervous system. So that's going to fire you up. Versus a recovery breathing strategy might be, I'm just going to take some long, deep, slow breaths at the end of a shift, right? Or maybe I've been in a meeting and it wasn't a very positive meeting and I'm kind of like anxious and angry about it. I can't go into the room to take care of somebody when I'm feeling that way. So I have to use a different strategy to augment the stress that's there. So the real problem or challenge that we have, Eric, is most people aren't equipped with enough tools to know where to actually start this process. And once they start to learn this process, like Dan was saying with our health leader training, is once we start to teach them these things and give them the strategies, now then they're armed with the right equipment to be able to improve their performance. And then the really important part is when we make it social, right? Is when more than one people are doing it at the same time. Then it now becomes something that's, hey, do you want to move right now? Yes, of course I do. And then that helps to galvanize people into wanting to operationalize it. Because if everybody's already doing it, the next thing you know, you've changed the way the culture is. At one point in time, remember, we, as an entire society, we deemed it appropriate to take cigarette breaks. So we operationalized not being healthy. We certainly can operationalize being healthy, but it requires the workforce really to help drive it, in our opinion.
Yeah, and Eric, just to tag on to that, because it's such a really good question. I would probably argue from what our experiences told us is where organizations struggle to execute this at the operational level is they jump to enablement. They get an app or platform, or they get like the content, whatever, and then they just download it, right? Without the context and without the groundswell from the beginning. So that's why we try to go in early and do the education piece and get our early champions. And those are the people who are going to model the way for everybody else in the organization. Then we help start to build it into the environment, whether that be through like our live labs where we're zooming in and John's showing up and doing this type of thing with everybody. And then once you're really bought in and everybody's feeling really good, yeah, we can enable you with technology, because it's great handing the app to a caregiver once he or she has bought in, has all the education and tools and has started doing it, and now just wants more content because they're trying to, I don't know, they have the headache thing and now they have a knee thing, right? So now they're like, oh, what's my movement snacking protocol for a knee? And now they'll go into the technology and actually use it.
Yeah, that makes sense. You brought up one or two other questions, but let's go to Rhett first and see if
Perfect.
others have questions, and we'll circle back.
Like Eric, my questions just keep coming the more you all keep talking. This is just highly applicable, and I'm curious as a sort of piggyback upon Eric's question, how in my experience working with senior living executives, I agree with you that having a groundswell is probably the best avenue. In my position, I have more access to these executives than I do the frontline employees. And I'm curious to know what uh, literature or research or studies you might have that demonstrate the sort of ROI. Sadly, as much as there are great hearts out there in the senior living space, there has to be the ROI in order for the conversation to even be entertained by executive leadership. And I'm just curious if you could speak to what does this do, if you know, for workers' comp claims, for sick days, for all of these other costs. That's a hard question, probably, but I'd love to hear what you have to say on that.
Yeah, no, it's a great question. So currently we're doing our own study from a movement snacking approach. We're going to be working with UNC Rex hospital system to measure those exact things and participate in our own study and our own programming. There's plenty of research to kind of show, we'll share some stuff with you, Rhett, around the impact that movement can have, particularly purposeful, intentional movement, have around injury reduction, particularly as it relates to back pain. It's a lot of the research that I've seen. They probably just focused on that because it's usually the most expensive injury.
It was constant in my executive director days.
Yeah, in that occupational space. And like my conversations with the executive level, where we start to make some inroads there, is when we can connect with them on a personal level. Almost every executive has probably had an injury or is experiencing back pain themselves. So when we can show that solve, it helps. We know for in the nursing community, there's a lot of studies that show the average back injury will result in between 30,000 and 90,000 in lost time, productivity, burnout, and insurance costs. So for us, it's going to be really showing this movement snacking approach and the adherence that it creates to a movement program, because that's been the challenge in the past with exercise programs. Everyone knows exercise is good for you. We don't ever get any argument about that from the research side. When we went to do our very first research study with University of British Columbia and Professor John Little, who's kind of one of the world's foremost experts in this movement snacking space, he told us that if we get about 50 to 60% adherence to this program with this non-moving population we were working with at the time, it was a cancer prevention study, we're gonna be super happy as researchers. That study itself, we had 92.5% adherence. So people will do the movements, they'll feel better, and then move towards preventing some of these negative outcomes, because that's where the ROI really comes in, is the prevention piece. John, you have anything to add to that? Like, I know you're a little bit more versed in some of the research stuff.
Well, you mentioned WCB claims, and that's been a real interesting one for us to dive in Canada. Is that I've got friends that work at WCB, like at the various highest level of WCB in Alberta, and what they found is if you lose somebody to a back pain injury and they aren't back to work, like feeling functional within 6 weeks, you've lost them for 6 months to a year. Like it's that quick. But the problem is the bureaucracy of getting everybody in alignment in order to get somebody treated in time in order to get there is almost next to impossible, from not only the workers' compensation, how backed up they are, to the physical therapist being on the same page as the caseworker, to the lawyer involved, to the actual representative of the organization. So everything gets delayed. And what we're trying to do is employ these people with people that have been injured with strategies that they can do while they're waiting for all this stuff to go through. And what ends up happening is they get caught in the whirlwind of bureaucracy and paperwork, and it ends up pushing them where we know that if somebody's injured, if I can get you moving better within the first 24 hours of the injury, I can significantly reduce your time of being injured. So rest is the worst possible thing you could do for an acute injury, but it's the first thing that's prescribed for people to do. And so we need to get, especially with low back, we need to get that joint moving immediately. So the answer to it is don't ever let that happen, right? Like, this is the answer to not losing money, is to prepare people to be able to tolerate the stress of their job. And if you can do that by teaching them how to move so that the tissues can be resilient enough to tolerate the stress of the job, and the joints are in the optimal instantaneous axis of rotation, we call it in our nerd world, which just means that the joint is in its perfect position, then you are significantly decreasing injury, and therefore that's preventing injury. And that doesn't even have us talking about strength or power or anything like that. It's just, are they ready to be able to deal with the forces that are going through their body in that moment, and do they have the skills to be able to maintain that throughout the day? The cumulative effect of doing a repeated load and of being a nurse or caregiver is even higher than that of a football player. So when it's all aggregated together in a day. So we have to think differently about not only how do they prepare and recover, but what are they doing throughout the day? And right before they know I've got a particular task I need to do, like transition somebody from a bed to a chair, what should I be doing for my sacrum and my pelvis right before I do that? Right? This is not about ergonomics. This is about, can my tissues tolerate this load? Am I hydrated enough to be able to receive forces into that tissue? Most nurses aren't hydrated. They're working on not enough nutrients and too much sugar and not enough water and lots of caffeine. So it's just also educating that nutrition piece, the sleeping piece, how to deal with shift work, and combining it all together to create a real performance related program that we can present to our executives and say, here's your ROI. Your ROI, it's a lot cheaper to bring some of us in to teach you how to do that than it is to lose 3 caregivers, because A, you're not going to find them. We're in a nursing shortage, and if you lose them, you may not ever get them back with the way that the system is currently working. I hope that answered your question, Rap.
Great information.
Thanks, Rhett. I see Matt, I think, is putting up his hand there in the corner. Yeah, awesome.
Yeah, just a quick add on, Rhett, for those really kind of particularly bureaucratic executives that might be given pushback, the studies I would throw out, there's a slew of really great research out of Europe comparing exercise with antidepressants, and exercise outperformed antidepressants for both depressive disorders and anxiety disorders. So for one of those bean counters that just needs to see the science, you could hand those studies over and then remind them, when people are having less depression and less anxiety, that means less burnout, less sick days, better milieu. When one person has a better milieu, a better attitude, the whole milieu improves. I mean, they'll understand that. I doubt hopefully they won't be asking for studies on that, the correlation between your mood and your performance and your participation and your sick days. But yeah, there's a bunch of great studies out of Europe that show that exercise is extremely powerful in terms of just keeping people feeling better, doing better, and showing up.
Thank you.
100%.
Thank
and that's
you.
why we said those 4 domains of performance, right? Mental and emotional is a massive driver to human performance, right? You watch the Olympics. There's a good example of how everybody is just zoned in and focused, and those people that get off track, right, and aren't able to get themselves back on again, continue to make mistakes. And so the mental and emotional side of we like to say that the physical, your physical ability actually fits under the umbrella of psychology, right? So if you're in a bad mood, doesn't matter how good a shape you're in, your performance is going to suffer, right? So that's where those live. And if there was anything that kind of sticks out more than anything else, and I'm glad you brought it up, Matt, is that if we can make a positive effect on the mental and emotional domain, it'll have a dramatic effect on physical, cognitive, and social. We won't make mistakes either. It's because cognitively I'm sharp now, right? Yeah.
So this may be an unfair question to ask at this point because we're coming right up to the end, but I love the concept that people in these clinical settings are athletes. And John, if I heard you right, I think you said that the aggregated effect on a nurse's body over the course of a day is more than a football player.
Yep.
Did I hear that right?
Yeah.
Correct.
Is there a study that we can point to, or?
Yeah.
Okay. I want to write about that. I want to put that message out to a broader audience. So that's a side note. But you've helped me understand that even for the administrator that sits at the desk a lot of the day, that is an athletic activity. It's difficult to sit there in one position. And in the same way that you talked about the eye surgeon developing the hump on his neck, if you're sitting at a desk all day, there are things that have to be done to prepare you to tolerate that level of athletic endeavor, to be static for so long. You've already talked about something that we can do with eye strain and a little bit as far as neck movement. Is there anything else that you would recommend for the executive or the other team member that has a more sedentary job that can help them prepare for that type of athletic endeavor?
Yeah, so we like to term them desk jockeys.
Yeah.
So they're riding that desk all day long, and so just like riding a horse, you have to learn how to move with that horse. Well, it's the same thing when I'm static, is how do I counter strain from that? So the challenge to the counter strain of being seated for long periods of time is to change your position relative to gravity, right? So if I'm in a seated position, I'm being driven in this position, I'm pounding on the keyboard this way, I have to counter strain from that. So it might be first the counter to seated is standing, right? Is stand up. Now, a long time ago, they said, well, what if we got standing desks? That would be better than seated. Well, no, because you're still static, right? So then they went, well, let's put a treadmill underneath you. I'm like, well, now you're really messing with your ocular system, because as you're moving, your vestibular system is trying, first and foremost, needs to keep you parallel with the horizon, right? So if you've ever tried to text and walk at the same time, that's a tough thing to do, or type on your computer and walk at the same time. Biology is not set for that. So the trick is always just to counter strain what you're currently doing, but don't try to go like, if I'm sitting over here, now I have to stand all the time, right? Like that swing is too far. So that's why the microdoses work so well, is just get up, stand up, move in a few different directions, and then sit back down and go to work. But the more frequently you do those little breaks, the better your body's going to feel, and the less that the body is going to have to lay down collagen and stiffen you, because that's the way biology reacts to gravity. Is I'm going to reinforce you and get you like this so that you can tolerate that game, right?
Yeah. Thank you. That's helpful. And in follow-up to that, one of the strategies that I've tried personally, and I'd love you to critique it, is I do have a standing desk, or kind of a sit to stand desk, and I don't stand all day and I don't sit all day. I try to just vary it. Like if I do a consult and I've been sitting and I don't have time for more of a snack in between, I'll just stand up for the next consult and try to at least move around a little bit. Do you think that's effective, or is there a better strategy I could consider?
Yeah, like variability is the key to health. So the more you get up and move in different directions, the better your tissues will respond to that stress, right? So that's why I didn't just get you up and move you in one direction, up and down or forwards and backwards. We're moving in lots of different directions, right? And reaching in different directions. That is how we make our tissues more resilient. Is if I do the same repetitive thing over and over and over again, then I'm going to struggle in other patterns of motion, and that's going to affect my movement skills. So not only are we just making your body feel better, but we're actually reinforcing movement skills that we once had. One of my mentors used to say to me, if you can't do something, you probably better practice at doing it, right? The goal is to get to move well in all directions, and variably, right? I call it our sphere of function. Our sphere of function is your three-dimensional bubble, your ability to move in all directions at different depths and different distances, right? That's your functional sphere. And so if I'm doing a lunge activity where I step and return, can I do that lunge efficiently within the same distance in every direction that I travel? And can I get deep towards the ground? And can I explore from a small range of motion to a larger range of motion in my step? That's your sphere of function for that particular movement skill. And so our goal is to always move you variably. So all my clients that I train, is their program never looks exactly the same from one day to the next, because they don't have to be good at one particular thing. I'm not training power lifters or Olympic weightlifters, right? That require them to be good at that particular skill. I'm training everyday folks that need to be good at everyday things. So that requires them to be able to have the capacity to move their body in time and space efficiently and effectively, which will ultimately be economically.
Mm-hmm. Yeah, love it.
Awesome. I saw Sarah asked a question here. Like, Sarah, all of our content exists in something we call our library. You can find on the Seven Movements website, sevenmovements.com. In there, we've got programs from everything from what Eric's talking about for desk jockeys. We call it our pain-free office toolkit. It's got a bunch of 7-minute movement snacks in there, right through to we've got a Parkinson's program, pickleball program. You can imagine it. It kind of exists in that library. So if you're looking for access to programs and kind of things like that, that's where that all exists. All the on-demand stuff that we do, and you can always find it on our website, or just email me and ask me what you're looking for, and I'll help you navigate it.
Thank you. Holly, you had your hand up there for a minute. Do you still have a question?
I'm good. Thank you.
Okay. All right. Well, this has been amazing. Dan and John, thank you so much. We appreciate you. We get a lot out of every single time that you present. And thank you all for being here, for your great questions, for participating. And if you're watching this on the replay, I hope that you'll pick one thing that you're going to apply as a result of this and just move a little bit more in some way in your life. So thank you. We look forward to seeing you again next week for another masterclass here at Mind for All Seasons.